Our group project is based on tackling the issue of diabetes. The current epidemic of diabetes is growing rapidly. Globally, there were 108 million cases of diabetes found in 1980, but had grown to 422 million cases by 2014. Adults that are 18 and above have seen an increase by 3.8% in diabetes cases between 1980 and 2014. Locally in Hong Kong, there are currently 700,000 cases of diabetes, and it is predicted to reach 920,000 cases by 2030.
There are two main types of diabetes, type 1 and type 2. They're different conditions, but they're both serious. There are some other rarer types of diabetes too. What all types of diabetes have in common is that they cause people to have too much glucose in their blood. But we all need some glucose. It's what gives us our energy. We get glucose when our bodies break down the carbohydrates that we eat or drink, and that glucose is released into our blood. We also need a hormone called insulin. It's made by our pancreas, and it's insulin that allows the glucose in our blood to enter our cells and fuel our bodies. If you don't have diabetes, your pancreas senses when glucose has entered your bloodstream and releases the right amount of insulin so the glucose can get into your cells. But if you have diabetes, this system doesn't work. When you've got type 1 diabetes, you can't make any insulin at all. If you've got type 2 diabetes, it's a bit different. The insulin you make either can't work effectively or you can't produce enough of it. In both types of diabetes, because glucose can't get into your cells, it begins to build up in your blood. And too much glucose in your blood causes a lot of different problems. To begin with, it leads to diabetes symptoms like having to wee a lot, being incredibly thirsty and feeling very tired. You may also lose weight, get infections like thrush, or suffer from slow-healing wounds. Over a long period of time, high glucose levels in your blood can seriously damage your heart, your eyes, your feet, and your kidneys. These are known as the complications of diabetes. But with the right treatment and care, people can live a healthy life.
Beta cells are islet cells in the pancreas that release insulin. In type 1 diabetes, these cells are mistakenly attacked by the immune system, which creates a deficiency of these cells for when the blood glucose rises. In type 2 diabetes, the beta cells become insulin resistant and don't function properly. Not enough insulin is released for every time the blood glucose rises, leading to dangerous amounts of glucose in the blood. There are many drugs used to control diabetes, including alpha-glucosidase inhibitors, DPP-4 inhibitors, and glucagon peptides. However, the most common are insulin injections and metformin. Insulin injections work by injecting insulin hormone directly into the bloodstream to bring down blood sugar. Metformin works by releasing less sugar from the liver, so blood sugar lowers too. There is strong research suggesting that beta cell regeneration can help diabetics change their life. Introducing regenerated beta cells in the pancreas of diabetics can give them the similar pancreatic function of a non-diabetic person. Scientists have found the location of progenitor cells in the pancreas that have the ability to develop into beta cells. When these progenitor cells were stimulated by a protein called BMP7, the pancreatic cells were able to differentiate into beta cells. This is important for type 1 diabetes, as the immune system is attacking the beta cells already there. Our solution is to use this method to generate functional beta cells at a rate faster than they are being destroyed, so that the body may still secrete insulin during times of high blood sugar. This must go with a combination of medication to reverse the autoimmune destruction.
So what is the feasibility of beta cell regeneration? Currently, it is socially accepted that those with diabetes must take daily medical treatments such as insulin injections or metformin tablets, and these are largely accepted to be a part of a diabetic's life. For those suffering from type 2 diabetes, there is also the need to exercise more and cut out sugar in order to control their condition. Beta cell regeneration as a type of treatment is likely to be costly initially, as specialist and specific technology are required to locate the progenitor cells in the pancreas that can differentiate into beta cells. However, considering the huge economic burden of diabetes at the current moment, it is important to consider this in the long term. While healthy lifestyle choices are obviously useful in the long run, the difficulty of changing your life after a type 2 diabetes diagnosis can be incredibly hard, and our solution can help ease them into this. Our second solution is the artificial pancreas.
Beneath your ribs, you'll find, among other things, the pancreas, an organ that works a lot like a personal health coach. This organ controls your sugar levels and produces a special juice that releases the nutrients from your food to help keep you in the best possible shape. While all this is happening, the pancreas works on another critical task, controlling the amount of sugar in your blood. It achieves this with the hormones insulin and glucagon, which are produced in special cells called the islets of Langerhans. Having too much or too little sugar can be life-threatening, so the pancreas must stay on constant alert. After a big meal, the blood often becomes flushed with sugar. To bring us back to normal, the pancreas releases insulin, which makes the excess sugar move into cells where it's either used as an energy source or stored for later. Insulin also tells the liver to shut down sugar production. The interplay between insulin and glucagon is what keeps our sugar levels balanced. But a faulty pancreas can no longer coach us like this, meaning that this healthy balance is destroyed. If it's weakened by disease, the organ's ability to produce insulin may be reduced or even extinguished, which can trigger the condition known as diabetes.
The artificial pancreas is a closed-loop insulin delivery system consisting of a continuous glucose monitoring sensor, also known as a CGM receiver, a control algorithm device, and an insulin infusion device known as an insulin pump. It can be broken down into two main parts, the CGM and the insulin pump. The CGM is a small device, as small as a dollar coin, which continuously detects the blood glucose level through the blood tissue fluid. Despite the recent emergence of needle-free CGMs on the market, most CGMs used commercially or clinically have a needle for penetrating the skin. Insulin pumps are a device that automatically injects insulin into the patient's body. There are two types of insulin pumps, one that consistently pumps small dosages of insulin with the backup of an algorithm, and another that injects a surge dose at a preset time. Back in 1959, the artificial pancreas was first designed by Professor E. Perry McCallig, an endocrinologist at the Cleveland Clinic. 50 years later, the technology has improved vastly and has already begun medical experimentation and certification. For many people, this solution may be more cost-effective and improves their quality of life overall. Our key solutions have a number of benefits compared to existing alleviating methods so far. Firstly, with automated treatment using the artificial pancreas or having the beta cells regenerated, patients are able to live life without worrying about missing a dose of insulin or metformin. This improves their quality of life compared to constantly worrying about continuous treatment. Using insulin and metformin can also lead to undesirable side effects, including hypoglycemia and hyperglycemia. Since our solutions are fully automated, the risk of the patient developing these and other diabetes-related complications is reduced significantly. Secondly, our solutions are more environmentally friendly. There are many parts when it comes to current alleviating methods, such as test strips, needles, and packaging. Our solutions are done internally, with minimal waste produced by the artificial pancreas having to replace parts annually. For beta cell regeneration, it would most likely be conducted as a minor surgery in order to put the progenitor cells into the pancreas, in order to differentiate into beta cells and beta cell hubs. The artificial pancreas would also require an installation and an annual replacement. This means patients will mainly do a one-off payment for the installation of the artificial pancreas or minor surgery for beta cell regeneration. This saves them money and time, as they no longer have to regularly check back in with the doctor to get medication and check on their current condition. Despite the many advantages, there are still some disadvantages our solutions have. Both solutions are relatively new in the field of medicine and bioengineering, which means that they are not mass-produced compared to current alleviating methods of insulin and metformin. Since they require special stem cell scientists to produce these progenitor cells, as well as the mass production of artificial pancreas parts, the overall cost for this type of treatment would initially be quite high. On the other hand, current alleviating methods are already mass-produced and have become ingrained in the medical system all over the world. In order for our solutions to catch up, they would have to go through many years of testing and approval before becoming a global norm in treating diabetes. Furthermore, beta cell regeneration is still not currently in medical practice. While scientific studies have shown success in regenerating beta cells, their success comes from highly controlled lab conditions. In general, a person's body will not have a constantly controlled environment due to the variety of activities that occur in everyday life. Thus, beta cell regeneration is still an area in which more research and medical trials need to be done in order to become a robust reality as current alleviating methods are. In conclusion, diabetes is still currently seen as an incurable disease. We hope that through the various key solutions we have offered, we can reach the following outcomes: improving the quality of life for diabetics by allowing them to live their life without the constant strain of timing and taking their treatments during the day. This will grant them a large degree of freedom in carrying on with other activities. We also hope that diabetes can be completely eradicated in the future, and this diagnosis no longer means a lifetime sentence of medical management for those who were diagnosed. By reducing the burden of diabetes in the healthcare system, more resources can be put towards researching other diseases